When patients hear about pancreatic surgery, most think of the Whipple procedure. But not all pancreatic tumors are in the head. For tumors in the neck, body, or tail of the pancreas, the operation is called a distal pancreatectomy. In this video, I'll break down what that means and why it's done, and what patients can expect. Hello, I'm Dr. Kaival, a GI and HPB surgical oncologist. My practice focuses on cancers of the pancreas, liver, and the bile ducts. Today, I want to explain the distal pancreatectomy, what it involves, how it differs from the Whipple procedure, and why it is considered safer and technically less complex, but still highly specialized. A distal pancreatectomy is a surgery where the tail and sometimes part of the body of the pancreas are removed. It is typically done for cancers in the pancreatic neck, body, or tail, neuroendocrine tumors, cystic tumors such as mucinous cystic neoplasms, rarely for other benign but suspicious lesions. Unlike the Whipple, which removes the head and involves multiple other organ resections and reconstructions, a distal pancreatectomy is more limited in scope. Often, the spleen sits very close to the tail of the pancreas. If the tumor is stuck to or invading the splenic vessels, we remove the spleen along with the pancreas tail. Whenever possible, surgeons try a spleen-preserving distal pancreatectomy, especially for benign or low-grade tumors, because the spleen plays an important role in immunity. But in cancer cases, splenectomy is usually required for a good oncological clearance. The key differences between a Whipple and a distal pancreatectomy are: in Whipple, it removes the head of the pancreas, the duodenum, with a part of the bile duct, gallbladder, and sometimes stomach. It requires 3 reconstructions to restore continuity. In distal pancreatectomy, it removes the tail and body with or without the spleen, with no reconstructions of the digestive tract. That is why distal pancreatectomy is technically less complex and recovery is usually smoother compared to the Whipple. Even though it is a simpler operation, distal pancreatectomy still has risks. The biggest one is a pancreatic fistula, leakage of pancreatic juice from the cut surface of the pancreas. Other risks include infections or abscesses, bleeding, risks associated with spleen removal, such as higher chance of infection later. To reduce the fistulas, surgeons refine closure techniques, staplers, sutures, or reinforcement with mesh or patches. Patients usually spend about 5 to 7 days in the hospital after a distal pancreatectomy. In the first few days, drains are checked for pancreatic fluid leaks. If the spleen is removed, vaccines are given to protect against infections. Nutrition support may be needed briefly, but most patients resume oral intake quickly. Recovery is often quicker than Whipple, but long-term outcomes depend on the underlying disease. Patients can live a normal life after losing part of the pancreas. In some cases, enzyme supplements may be needed for digestion. A smaller portion may develop diabetes, especially if a large portion of the pancreas was removed. Regular follow-up with scans and blood tests is important. If the surgery was for cancer, further treatment like chemotherapy may be advised depending on the final pathology. To summarize, a distal pancreatectomy is the surgery of choice for tumors in the neck, body, or tail of the pancreas. It is less complex than a Whipple because no reconstructions are needed, but it still requires expertise, especially to reduce the risk of pancreatic fistula and to decide whether the spleen can be preserved. If you or a loved one is facing this surgery, seek an experienced HPB center where your care is tailored individually. If this video helped you understand distal pancreatectomy better, please share it. Don't forget to like, subscribe, and stay tuned for more patient-friendly explanations on pancreatic, liver, and bile duct cancers.